Not all fractures are emergencies, but some are. So fractures that can wait are basically most fractures. They can be managed within a week. It's no big emergency. But for fractures that must be managed in an emergent fashion, are fractures that are associated with something we call compartment syndrome. That is that we shall maybe discuss as well. Fractures that are associated with joint dislocations. The saying is that the sun should not set on a dislocated joint. So fractures associated with dislocations need to be fixed in an emergent manner. But everything else can be able to wait as we plan for the best time to be able to manage them. So compartment syndrome occurs as a constellation of symptoms in the setting of a fracture. So if a patient has a fracture of their shin bone, which is the tibia, and that is associated with pain that is out of proportion to the injury. If you have reduced blood flow, which we will describe as pallor of the skin, and sometimes it can get to pulselessness and also paralysis, such that they cannot be able to move the leg. So once you have pain out of proportion to the injury, then this is something that should warn your surgeon to be able to perform what is called a release of your compartments so that blood can be able to flow correctly. What happens is that muscles in the leg are within compartments. So those compartments are supplied by a blood vessel and a nerve. So if pressure within that compartment exceeds the pressure that pushes blood into the compartment, then that blood flow stops to flow within that compartment and to the tissues that are peripheral. So when that happens, that is actually a surgical emergency, and that needs to be sorted out as quickly as possible. If you have any fractures that you'd like us to look at, or if you have any concerns with any x-rays, please share the same across our DM, our direct message to all platforms. Thank you.